Welcome back. Thank you for sharing all your favorite highlights of the summer and your name and all that information. So our last meeting was in June. So we've taken a little bit of a break the last couple of months. So it's great to see you all back. This September meeting is going to be focused on a listening session and will contain a presentation about planning efforts. And then we're going to break out into groups. We hope that everybody stays engaged and shares their thoughts and information. This is a place where your expertise is really valuable for us, so it'll be great to hear from everybody. There's not going to be a public comment section this month, but the public comment section form is available, and Martin will add that link to the chat, and you can submit a comment from the link on our HSSN webpage. Let's go ahead and kick it off with Katie Gentry. It's a program update for the Homeless Services Division. Katie, whenever you're ready, go ahead and get us started.
Hey, Katie, we can't hear you. Fun of switching between Teams and Zooms.
Let's try that. Can you hear me now?
Yes.
Great. Katie Gentry, she and her pronouns. I work at Washington County overseeing homeless programs. I work alongside Nicole Sting and Tim Ellsworth at Washington County. A couple of big updates. We released contracts for our new fiscal year. So all of our providers are now under contract for the 25-26 fiscal year, and we are actively moving through kind of getting to work with this new fiscal year. We did have some budget reductions, but are easing in through those budget reductions over the coming months. Separately from that, we also are in the process of rolling out our Continuum of Care grants. So those are federal grants that come in. Our board signed those federal grants July 22nd, and we are now actively working to get contracts in place with all of our nonprofit providers that are subrecipients of that grant. That brings about $5 million in locally and serves about 250 households annually, in addition to our local tax funding. A couple new programs that are coming up with Washington County. We just closed last week an RFP for transitional housing, specifically focused on recovery. We had quite a few applicants for that, and we're really excited to start evaluating those applicants, and we should have an announcement of a selection of a provider by mid to end of October. We are also launching a housing resolution fund, which is going to be a combination of move-in funding and homeless prevention funding. That fund will go live in January. Folks will have to be engaged with a provider in the community to be able to access those funds. But that will start in January, and there's definitely more information to come on that. We are spending the next year or so really evaluating coordinated entry as part of our local implementation plan. So today is a great time to engage with all of the things happening with the local implementation plan, but we are also going to start a series of questions and surveys that you will likely see in an upcoming HSSN newsletter to really evaluate who are we serving through our coordinated entry process. Are we asking the right questions through our phase 1 assessment, and what does that look like? So the team has been actively working on that over the past few months, and we'll continue to engage with that until we roll that out in kind of spring of next year. And we'll probably also include focus groups and times with you all in the coming months. We are the last kind of big update is our Hillsborough shelter is opening late fall, early winter, I don't know. November is our timeline for opening that shelter. Huge congratulations to Project Homeless Connect for being awarded that contract, and we are looking forward to opening that additional capacity in our shelter system. I think those are all the updates from me, but happy to jump into any questions that folks have or answer them in the chat, and I will turn it back over to you, Charlie.
Thank you, Katie. Feel free to put your questions in the chat, or you can always unmute. We do have a few more minutes, so we can take a couple of people who might have questions and they can unmute and ask those questions. We have one from Josh, Hillsborough shelter opening fall of 2025? Question mark? Oh, November 2025. Great. Awesome. Gonna give it just another minute. Okay. Well, if you think of anything, feel free to put it in the chat as we go on. Next up, we're gonna take it to Nadia, who is going to share and present our slides for the day. Nadia, whenever you're ready.
Hey all, I am sharing the slides and Jesse and Nicole are going to talk about the local implementation plan revamp.
Hey y'all, I'm Jesse Adams. I am on the strategic projects team at Washington County. I use she, her pronouns. And I'm going to present with the strategic initiatives manager, Nicole. I'm going to kick it off and Nicole's going to talk a little bit more specifically about what we're going to do today. And then we'll break into some groups. But actually, Nadia would do the next slide that has the agenda while I'm talking about the agenda. Sorry about that. So yeah, I'm going to give you all a little bit of background on what the local implementation plan is and how we got to the place we are at today. Nicole's going to go over our engagement plan. I will lay out the plan for our group discussion, and then we'll leave off with next steps. I do want to say that this is part of a really robust engagement plan series, and this will not be your only time to be able to provide feedback. So we'll kick off the discussion today. It is there are big questions and lots of things to think about, but don't feel pressure to have all of your thoughts out today. There will be lots of other opportunities for you to provide those to us. So first, I'm going to talk a little bit about how we got here and really what is a local implementation plan anyways. Next slide, please. So when Metro passed when the SHS measure was passed several years ago, part of the point of the SHS measure is to have it be implemented regionally, right? That Multnomah, Clackamas, and Washington all got separate allocations of the money. And the point in that was that we were all going to be able to spend the money in the best way that suited our community. So we used what was called a local implementation plan to describe that to Metro, saying this is what our community needs and this is how we're going to spend this money. So yeah, it basically from the measure, these are the actual words, describe how the supportive housing services will be prioritized and delivered to address our local needs. And in the measure, again, it mentions specifically comprehensive community engagement. That is what we are here today doing. Nicole's going to talk a little bit more about what we have done so far and continue to plan to do, because yes, it is really crucial to us that we do a comprehensive engagement series to get the feedback from you all now that we've been implementing this programming for about 4 years at this point. So how we came to the first LIP, there was an initial committee convened that contained continuum of care board members, HPAC committee members, culturally specific providers, and they gave a list of recommendations from discussions with each other and some community engagement and outreach, and gave them to a consultant. And that consultant drafted an LIP, gave it back to them. That committee then grew to 75 members that included both public and private representatives from over 40 different organizations. And that really large group gave feedback on that draft, which resulted in a final draft. That LIP still exists today. It is 187 pages long. So I'm sure we've all read it and committed it to memory, and county staff included. But yeah, it exists. It guides the work that we do. But that is one of the things that Nicole and I and the strategic team at the county are that's one of our goals, is to make it a little bit shorter and more digestible and something that we can really refer to consistently as a tool to guide the work of this really life-changing money. Nicole, I think I'm passing it back to you at this point to talk a little bit about the revamp plan and the community engagement.
Yeah, thanks, Jesse. And hi, all. Good to see some faces and some familiar names. For those that don't know me, my name is Nicole Sting. I use she, her pronouns. I serve as Strategic Initiatives and Relations Manager here in the Housing Department. We're really excited to be talking to you about this project because on the next slide, as you see, this has been many months in the making. We at the end of last fiscal year, as we were putting together our work plan for SHS and for Metro, we realized, wow, we sure have achieved almost all of our LIP goals. Incredibly exciting halfway through the supportive housing services measure to be at this point, and also a bit of a call to action to us to ensure that our LIP is reflective of the system we have now and where we want to go as a system. So to start these conversations, we've been working with the homeless services teams to understand where they see the needs for an LIP update and what types of community engagement we should do. Then throughout the summer, we've been planning that engagement. We've had some of our strategic conversations with advisory bodies, with other partners, county departments, other public funders, and really we're beginning the community engagement with you all. This is our first kind of come one, come all offering. We are planning on doing a public hearing with Solutions Council. I know I see some members and see Kim Marshall, our chair, here as well. We're also planning for an online survey and hoping to do some additional focus groups. So there's a series of planning of additional engagements aside from this one that we'd like to do, but we understand that you all are people that are most likely to be engaging with the homeless services system. So we wanted to start with you and center the thoughts of providers in this space. So we are going to be kind of continuing this engagement throughout the fall. Previous slide, sorry, not quite done. We'll continue this engagement throughout the fall. And then we're starting to draft really now, but most of that work is going to happen at the beginning of 2026. And our plan is to come back to you for a round 2 engagement. We'll talk more about that after our small group assignments. Now with the next slide. And as we're talking to these folks, we want to make sure we have the right people in mind. So this is a list of some of the people we're planning on talking to. I mentioned we went to the Solutions Council. We're also really excited for a joint meeting of the Lived Experience Advisory Committee as well as the Resident Advisory Board scheduled for this month. We'll be working with the Board of County Commissioners later on. And some partner conversations are continuing and happening now. Some are still being planned. As I mentioned, other funder conversations have happened. And we have some key community groups you all listed as well as opportunities for us to get feedback. But we do, as part of this process, want to hear from you. Are there any groups missing from this list? Are there existing tables that you think we should bring this conversation to? No need to kind of think of all of that now, but want to make sure that you know that we want that feedback from you as well, and we're interested in knowing if we're talking to the right folks and moving forward in the right way. So if you can add that in the chat now, if you think of it later, you're welcome to reach out to Jesse or myself. But next slide, just to share more about the intent of the phase 2 engagement. This will occur after we've done our drafting. So the idea is that we're going to take feedback from you all, use that to update the local implementation plan. We're not sure if it's going to be a full-scale update, an amendment, an addendum. We're still working through that, and a lot of that will be informed by what we hear from community. But we do plan on bringing that back to close the loop and ensure that our community is bought in on the local implementation plan. After all, the county might be the one drafting it, but it is our plan of what we want to do together as a system. And we want to kind of at that point see, did we miss the mark? Did we hit the mark? Where are we at in terms of this plan? And before we go to what the revamp could look like, we'll talk more about this at the very end, but want to confirm that this LIP update has to be approved by our Board of County Commissioners and comply with any requirements from our Board of County Commissioners, as well as then go through to the Supportive Housing Services Oversight Committee and the eventually the Metro Council. So there'll be a number of kind of next steps coming from our phase 1 engagement and then the phase 2 engagement, but we look forward to keeping you updated as that all moves forward. The next section here, I'll talk about what a future LIV revamp could look like. But first, on the next slide, I'll just to share, there's some key LIP requirements that we have to keep front and center. All right, so these are all listed here. As I mentioned earlier, if we're substantially changing any of these components, we do need to go back through those approval bodies. We are anticipating that, we're assuming that we are making substantial changes, and we'll be surprised if we're not. We expect particularly updates, as Katie mentioned, around access coordination, the how we make decisions around access coordination, not necessarily what our prioritization schema is what will be in the LIP. We're also hoping to update our funding investments, both current and planned. Our LIP, as I mentioned earlier, envisioned a system that we have far surpassed. So the next slide will describe what's in our current LIP and our current Washington County system. So first and foremost, we thought we were bold in claiming we would create 250 shelter units. Y'all, we have far surpassed that goal, thankfully so for our community. We thought we would have around 165 supportive housing slots. That's about accurate, but we do have additional shelter plus care, transitional housing shelter spots, and non-supportive housing long-term rental assistance we've launched. So that's changed quite a bit. We've also established, instead of building just a network of culturally specific organizations, we have a cohort of culturally specific organizations that meet regularly. We've implemented a racial equity lens tool and are doing more deeper tracking of programs by outcomes by race and ethnicity, and want to ensure that that work is reflected in our LIP and we're held accountable to the practices that we observe now. And then creating a standard of care. We have program manuals, policies, procedures as all part of our system. So before we go into small group discussions, I'll turn it back over to Jesse to describe that process. But if folks wouldn't mind using the raise hand function or some type of emoji reaction, if you have read the LIP at least once, if you could raise your hand, show some type of reaction. This is no shame here, but just curious. I see a couple thumbs up. That's great. That's great. This is great. I saw some of the names and I'm not surprised. But again, our goal here is that eventually we're creating something that I see thumbs down, so that's okay too. It's a long document. Our goal is that we make something that's usable for all of us together. But to do that, we want to first hear from you. So I will pass things over to Jesse to walk through our group discussions.
All right, I think next couple slides here. Yeah, one more. There we go. All right, so today we're going to break out into smaller groups so we can have some more robust discussions. We're going to have Lindsay here is going to pop up options of breakout rooms to join. There will be 4 different options. Choose whichever one you identify the most with, whichever room you would like. There, I think you can also switch once you're in them if you'd like as well. But yeah, there will be 4 options. It doesn't pop up like right away in your screen. You will have to go to the bottom. I think it's the bottom right of your screen and click that little join breakout room button. And then the 4 options will show up for you. We're going to take the first 10 minutes to read the questions, kind of answer any thoughts or, get any clarity you have about those questions, and then put your initial thoughts into an easy retro board. This next slide, I'm going to walk through what an easy retro board looks like and how to use it, just in case there are folks who haven't quite done that yet. And then we are going to take 20 minutes of a group discussion to talk through the things that are on the easy retro board, add anything, any clarity, additional thoughts before we come back to the larger group and the facilitators share out. There will be a county facilitator and note taker in each room with y'all. And then Lindsay is going to hang out in the main room for any kind of help or technical support that we need. So when we break out into the breakout rooms, we will have a link in the chat to the easy retro board that you can click on, and you will be able to add the thoughts yourself. The facilitator will also be sharing screen so everybody can see what's being added, and they can add their thoughts as well to facilitate the larger group discussion. But there will be columns with each question in them. You can click the plus to add your thoughts. And then as described here, you can edit or delete with a little pencil or trash can once you publish your thought. You can also use the comment bubble in there to respond directly to a thought that somebody else has posted on the board. Anyone else want to add any easy retro tips or tricks?
jump in, Jesse, and just say, don't be shy. It's always hard to be the
Yes.
first person typing and adding to it, but don't worry. And I'll also clarify, comments are anonymous when you're adding them here. So
Yes.
if there's something you don't feel comfortable saying out loud, you're welcome to just put that in the chat. And if your group is too small and you're not feeling comfortable, you can kind of raise your hand, come back, and join a larger group if that makes you feel more comfortable providing feedback.
All right, can we go to the next slide really quick? I'm going to go over the discussion questions as a large group just before we break out to add any clarity, because they're big questions. And so any clarification you need, let me know before we break out. But the first one is about system throughput. How do we balance the system to address community need with finite resources? And how do we find that balance? What questions do we ask each other to get to that answer? So this question is, again, very high level. The LIP, we want to stay away from the numbers we put last time, right? Because as Nicole showed you, we achieved it, right? We want the LIP to be kind of a guiding document and not have specific metrics. So I'm not looking for things like, well, we need, 450 shelter beds and 200 transitional housing beds and things like that. But really, what kind of things would we look at to make sure that the system is addressing those needs, right? That there is enough shelter, that there is enough transitional housing, that there is enough permanent supportive housing. What questions would we need to ask each other or ourselves as a system on an annual basis to make sure that the system is functioning as intended? So again, really kind of high level guiding document. How do we do this work? Second one, how do we work with other systems to address the higher acuity needs? Anyone who has been in this work for a while or even not a while, right? We're seeing much more higher acuity households than we have before. And I think the homelessness system is struggling a little bit, right, to be able to meet those high acuity needs. How do we work with the healthcare system? How do we work with the behavioral health system to address those needs? We can't pay for all of that. We don't have the funding to do that. So how do we make sure that our households are accessing the supports that they need? And then using the LIP. As mentioned, the LIP exists now. I think many people in the room have not read it. It is also 187 pages long. I'm going to keep driving that home because that is crazy. We are going to make it much shorter and hopefully more easy to use. So how should we use it? What would make this a useful tool? What would make it so you would actually go look at it and have it be, something that informs the work that you do? Any questions?
While folks are thinking of questions, I want to emphasize what Jesse said. These are really big questions. These are, I think, the biggest questions our system is grappling with. And would just encourage you, if you don't feel like you have a clear answer, to add, what would be some of the thoughts or curiosities you have to get to that answer. That's just as helpful information for us.
100%. Yep, I can't answer that question because I don't know X, Y, and Z. 100% awesome feedback and really would help us to get to that answer as well. All right, if there aren't any questions right now, we can jump into those smaller rooms.
We talked a lot about kind of resource sharing and understanding where to go for certain kinds of resources, and also the ever-changing needs of folks, in terms of what sorts of resources they need, which can change from how they're going through the system, and those specific needs may change, based on, you know, whether they're going from needing housing to getting housing to, then, having problems with the housing and the standard of care there. So those sorts of things came up. Another thing that came up was about children and families and feeling like the system doesn't cater or doesn't focus enough on children's needs, and recognize that we do have a number of children in the community who are who do not have stable housing, who might be living in their cars with their parents, and having resources available to support those families. So often the folks who are working to support those families, again, they're struggling to find the services and access to opportunities and support for those folks too. Trying to think if I think that was those were the main areas that folks focused on in our discussion. And you can see here, I'll leave it up for a moment if anyone wants to read the comments. I see that there's stuff in the chat. I don't know if that's... Oh, another comment about the youth. Yep. Yeah. And that was a big one. I think that got a lot of when the initial when that was initially brought up, that got a lot of support from other folks in the group who were recognizing the same issue. All right.
All right. And then I think Martin, were you the third group?
Yeah, I'll go ahead and throw my board up here as well. If I could say one overall theme, I think it was kind of like this idea of like knowledge gathering, knowledge sharing as well. Knowledge is for sure power. So if we talk about like system throughput, there was a lot of like questions and some great thoughts from the group. So thanks again to our group. So for system throughput, it was really like, what are we measuring? How do we make that available, and how do we use those measures, like whatever data that we're measuring, how do we use that and compare it, to how we're serving our community? So it's really, I think, maybe makes sense as, as community member and non-homeless services staff, is like, really, how do we get this information? And then how are we using it? Uh, for the high acuity households, I think we kind of went away from like our traditional thoughts. So with those high acuity households, we know that there's some healthcare system needs, there's behavioral health, but I think like our group was really like interested in what are some of those other services. So libraries, for example, just what are some of those other like faith-based organizations? How are those being identified? Like what else do we know is out there? And then how are those being brought into the system as well, to help kind of knit all of our services together? For using LIP, I think this was a pretty easy one, and Jesse was definitely giving us some hints here. But yeah, making it shorter, more digestible, and more accessible, I think were kind of the big themes. Whether we can publish the LIP on a website, so it's a little bit more easy access for everyone within the system who are being served by the system, working within the system, or even just community members at large. And then yeah, how do we make this information more digestible and accessible, of course? So like executive summaries, you know, smaller length, and something just a little bit more readable. And then within that too, also, how are we sharing that information with the community system? How is the money being spent? How do we advertise all this great work that folks are doing, and where the needs still lie? And then some other good thoughts from kind of our potpourri section that captures all the rest of our thoughts of some specific things potentially to include in the local implementation plan.
Awesome, thank you. That leaves me, hold on, I'm going to share my screen here as well. All right, then pull up my notes 1 second. So a lot of the things that have been mentioned already, we spoke about as well. I'm going to call out some things that I haven't heard quite yet. One of the things that came up with how to make it more accessible was to make those kind of executive summary, shorter versions, but have them be audience specific, really targeted to the groups that you are talking to. And as part of that, a specific call out to have those executive summaries available in different languages as well. And then a good call out for accounting staff in particular, referring to the LIP in various spaces, not just, I think this is probably the first time I've gone around and talked about the LIP for sure. So when we're doing presentations about work plans, anything else, to be able to refer to the LIP and show how that has informed our work. So just to make it a little bit more known. And then we talked about having like the success, like how we talk about the success of the metrics. Like, yes, the numbers of like we housed X amount of people, sure, always important, but making sure that we humanize it, right? Have those stories like this is how this money and work impacts folks, but then also how that money, like spending X amount of dollars, really saves the community, right? Folks, I think we all experience that you tell the general public how much we've spent and they think the problem should be fixed. So saying, you know, like we house a household for this amount of money that saves X amount of money in law enforcement and X amount of money in healthcare services to really show like how much impact these dollars and services have on a human level and on a financial level. We talked about including direct service staff and the staff that does this work in the LIP, like talking about the wage goals, the training, the certification processes that they could have access to, basically making sure that the LIP addresses supporting the workers that support the system and how that overall supports the system. I think everything else on here has been kind of mentioned. Oh, the last thing that came up that got a lot of reaction to from folks is how to take feedback from participants. Feels like it focuses a little bit on grievances. So how do we get other information from folks, like having a participant survey, and then also looking at retention metrics 1 to 2 years later, making sure that we have all of those metrics as well. All right. Okay, I think that's all to share out. Is there anything anybody wants to add? I'm sorry, I'm reading the chat comment here.
So while you get caught up on
Yes.
that chat comment, and before we go to next steps, wanna do share, we're gonna save the boards, the Easy Retro boards as they are now, so we have that, and then we'll send out the links to all 4 links to this group here. So please do feel free to share them. Ask folks to use the board that they feel the most affinity with, just to again help us with that analysis. But we do want to make sure we get as much feedback as possible. I'm kind of changing our plan midstream, so staff, if you disagree, feel free to jump in. I'm thinking end of next week is when we'll leave them open till. Does that feel good? I'm seeing nodding.
Yeah, sounds great. All right, I think we have the next step slide. Do we want to share again, or Nicole, do you just want to talk through?
I'll just talk through it. I
Okay.
don't know that we need to pull it up again, but as I mentioned, we have kind of a few series of engagements. You are welcome to invite us to an existing table. I chatted with our executive and senior management group about inviting us to staff meetings. There's a number of Washington County staff on the screen right now that would be happy to go and hear feedback from your staff. So let us know if there's existing tables that you want us to hear from. We'll be drafting the updated LIP over the winter, as I mentioned earlier. We're not quite sure what shape that takes yet. The feedback we're receiving today is likely influencing what shape that LIP update takes, but we'll get that draft going, and then in late winter, early spring, we do plan on doing another series of engagement. We probably won't go to every single group we went before. Capacity is a constraint, but we'll be sure to come back to HSSN at the very least as a central place to hear from a lot of different folks and include communications in our newsletter and other forms. So What I hope you hear today is that our door remains open. This is a large scale project, and we need the influence and input from you all in this work day to day. All right, and I think that concludes. We can wrap up a bit early. Charlie, I'll turn it back to you.
Thanks, Nicole. Thanks, everybody, for sharing in this rich discussion. I know that I have some new things to think about, so I appreciate that. And yeah, if I'll just say if your organization is interested in presenting for HSSN, it's a good way to, again, like everybody said, keep us all updated within the loop and share the information that is necessary to support our participants. So please reach out to Lindsay, and Lindsay will drop her email in the chat. If your organization is interested in that, it's always good to hear what everybody's doing. So even if you just give a brief description of, you know, what you're up to, that's very helpful for everybody. So just a reminder, our next meeting is going to be October 1st at 8:30 a.m. And I'm going to just open the floor and see if anybody has any events, kudos, highlights, agency events coming up. Maybe even if you're aware of some resources, you can always put that in there as well. So just take a minute, and anybody that wants to contribute to that conversation. Yes, happy Hispanic Heritage Month. It's also Hawaiian well, I don't know if it's heritage, but Hawaiian Sovereignty Month, recognizing that, and then also suicide awareness. So yeah, awesome. Thank you all so much. Taught in Portland, I'm teaching 2 cents. Oh, okay. So Matt's teaching 2 census sessions of Rentwell a month if people have clients and need it. I think they also do an online program now, so that's a little bit easier for some folks depending on how they learn. Awesome. Thank you for that, Matt. Okay. Well, thank you all again. I will see you next month, and I'm going to end the meeting now. Goodbye.
Thanks all.
Thank you.